Good morning. We are really excited to have this public health roundtable. I'm, of course, Ron DeSantis, Governor of Florida. We have visiting us across the pond via Zoom, Professor Sunetra Gupta, a professor of theoretical epidemiology at Oxford University. Of course, we have Dr. Scott Atlas, Robert Wesson Senior Fellow in Healthcare Policy at the Hoover Institution at Stanford. He's been here before. Dr. Jay Bhattacharya, Professor of Medicine at Stanford University and Research Associate at the National Bureau of Economic Research. And then we have Dr. Martin Kulldorff, a biostatistician, epidemiologist, and Professor of Medicine at Harvard Medical School. We had both Martin and Jay over the summer, at the end of the summer, talking about kind of the state of play with the COVID-19 pandemic, evaluating some of the policy choices that have been made in different parts of the United States as well as around the world, and covered a lot of good ground. Now we're 6, 7, 8 months down the road from that, and I thought it would make sense to bring them back as well as to bring Professor Gupta and Scott Atlas. So first, we asked both Jay and Martin, are lockdowns effective? Do you recommend that any state or country do lockdowns going forward? And I think both of you advise strongly against it. So here we are, 6, 7, 8 months down the road. Martin, do you stand by what you said, and have you been proven to be correct?
I do stand by it. I think it's obvious by now that these lockdowns and contact tracing en masse, they were not able to prevent a resurgence of the disease during the winter. And the problem is that the belief that the pandemic could be suppressed through these lockdowns meant that in a lot of places in the world, people did not use focus protections of the old. They thought that the lockdowns would protect the old, but they didn't. So they didn't put in the standard public health message to actually properly protect the older, high-risk people. And I think that's very tragic, and it has led to many unnecessary deaths among our older citizens.
Jay, do you stand by what you said, and how do you think the last 6, 7, 8 months have borne out?
I think
Can you move the a little closer?
I think the lockdowns are the single biggest public health mistake in history. I think the lockdowns have as Martin said, have failed to protect the vulnerable. The lockdowns has led to many unnecessary deaths, both directly as a result of the lockdowns, and also indirectly through this misplaced faith in our ability, misplaced faith in the ability of the lockdowns to protect the vulnerable. We should instead have adopted a policy in most places. Should have adopted a policy that got rid of lockdowns and instead focused on people we knew to be truly vulnerable to the disease, older populations, people with certain chronic diseases. Adopted policies actually much more similar to what Florida has adopted, rather than the state where I live, California, which has relied on lockdowns to disastrous effect.
Professor Gupta, across the pond, I know that they've instituted a lot of lockdowns in Great Britain as well as throughout Europe. You've been critical of that. Do you stand by your criticism? How's it going in Britain now? Are you still on lockdown? And what do you think the efficacy of those lockdowns have been in Britain?
We are still under lockdown, even though we've vaccinated the bulk of our vulnerable population. So people are at the moment suffering all the costs of lockdown without there being any obvious benefits, should this have been the case in the first place, that there were any benefits. Myself and many others, including Carl Hennigan, have been warning consistently that these policies are detrimental, that they have a very high cost, and at least that those costs should be visible and on the table before any decision is taken. And focus protection, of course, offers a kind of solution to the stark truth that we in the UK cannot afford lockdowns, nor indeed, as indeed is the case in most of the world. And the other reality is that an imperfect lockdown is actually closer to a let it rip strategy than a focus protection strategy, which I believe is easier to implement.
Dr. Atlas, you were on the coronavirus task force at the White House for a time. I think the two things you were very forceful about was we shouldn't have lockdowns and we should have open schools. That was counter the prevailing narrative, certainly in Washington, and I know that they tried to rough you up for speaking those views, but you were very clear on that. Do you stand by your position then, and do you think the experience has borne you out?
Yes, I think it's clear for people who care about the data that the lockdowns, as we had talked about many, many times, were extraordinarily harmful. There's no question that people have, 40% of people didn't get chemotherapy, up to 78% of cancers didn't get diagnosed, people forego medical care for emergencies, all because of fear. And, we have a massive public health price to pay as we go forward. And then we look at the data, and the data is really clear that the states in the US, we have the comparison. We happen to have done the experiment because of Governor DeSantis here, and we can compare what happened. And when we look at that, the actual results, the facts of having an open state, which was Florida, versus these other states, we see when you look at things like excess mortality rate, which is the number of deaths over what you would have expected that year, and you take it during the pandemic, it turns out Florida beat 70% of the states. Okay, these other states did severe lockdowns. And when you look at Florida compared to California, I'd like to point out, California did 50% worse than Florida because of its severe lockdowns. And there are many statistics like this. The lockdowns were harmful. They were the opposite of what should have been done. We said it from the beginning, and there's a massive price to pay. It's not just that they failed to stop the infection. The lockdowns actually killed people, destroyed lives, destroyed families, and in the end, vis-a-vis the schools, our country, more than any other country, frankly, was willing to sacrifice its children out of fear. And this is really one of the historic, epic tragedies, really, of what happened during the pandemic management. It was advocated by many of my other task force members to do the lockdowns. They got what they wanted, and it's a failure.